Good afternoon, everyone. Thank you for joining our Advocacy 101 session in the Equities Challenges track today. We are really looking forward to having a great session. We'd like to start off with a few notes on logistics. This session is being recorded and the chat is being archived. Attendees are in view-only mode to keep things orderly, so you are unable to use your microphone. We encourage you to use the chat box throughout the session to engage with the group. You can post here for any technical issues you experienced, as well as any questions you would like to share with presenters. We will share these questions toward the end of the session. This session also uses auto captioning. While these captions will not be exact, we hope that you can improve accessibility for all attendees. To activate these as a viewer, please look for an option, your toolbar. Please look for an option on your toolbar that says live transcript and select either subtitles or full transcript, which will appear in a sidebar. Your options may differ on a mobile device. Please ensure that you are using gallery view and not speaker view on the screen to ensure you will see the active interpreter alongside the speaker in the session. If you are intending to claim professional development credit through SC Endeavors for early educators attending this, please complete the submission form we're about to share in the chat box before the end of this session. This is essential to having the information needed to process your credits. Remember that you must attend the session for its full 1 hour duration to receive credit. At this time, I'm pleased to introduce our presenter for this session, Bryan Boroughs, the Vice President and General Counsel at Institute for Child Success.
Thank you, Mary. And welcome everybody. It's nice to see some familiar names in the participant list, as well as some new friends. And welcome. Can we have the next slide, please, Lisa? Just wanted to briefly go over what we'll be discussing today. So we're going to start out with demystifying advocacy and giving a framework around how to think about advocacy. We're going to discuss a few ground rules for advocacy when you work at a nonprofit, because we understand that a lot of folks here are doing that, and sometimes that can sound scary. Want to talk about sort of when you're engaged in advocacy, balancing pragmatism and idealism, and also adopting a network mindset and spirit. And we're happy to discuss, so this last point, discussing upcoming State House legislation. If you have particular topics that you want to engage in on that front, please feel free to pop that into the chat bar. Next slide, Lisa. Oh, one back. Thank you. So this is going to be just a general discussion part, so you're not going to see much on the screen for a minute. When you think about advocacy, what a lot of folks think about is what they have recently seen on Fox News or MSNBC or CNN, and that is a significant element of advocacy, but it's also the smallest part of what we're going to be discussing today. There is a huge amount of work that you can do that we would describe as low-hanging fruit, that doesn't get into the sort of entrenched warfare that you might see in the popular press. So hang on one sec, back up. Thank you. So when you think about advocacy, we're talking about discussing policy with legislators, their staff, governors, their staff, and sometimes agency folks as well. And one of the things that, especially if you're familiar with the sort of political football that you would see in the popular press, it would be easy to forget that all of these policymakers are humans who want to do the right thing. And, you know, I've worked with a lot of members of Congress, I've worked with a lot of agency folks, and it's easy to forget that when all you see is what's in the news. But I have never worked with someone who I didn't think was wanting to do the right thing, even when we disagreed vigorously about the topics. And so the next challenge for them, though, is that they almost never know what that is. And I don't mean that in a pejorative sense. I mean that to say an elected official may come to the job with a set of knowledge and expertise from their prior career, but it's usually a very tiny part of what they're responsible for as a policymaker. So an elected official, for instance, might be on a committee in Congress that covers health, education, labor, and pensions, and that's just one committee. And so if you happen to come in as a doctor or as a nurse or a community health worker or a teacher, you've still only got a small part of the expertise that that committee is responsible for. And so policymakers tend to deal with this in a couple of different ways. One is just straight up doing what their constituents tell them to do. And then the other is listening to what experts are asking or are suggesting as the best path forward for a particular issue. And one of the things that I always love about talking to a group like this is that you're both. You are both constituents and experts in the field that you're looking to advocate on. And so that gives you an incredible amount of influence. Now, I would be remiss if I didn't say that there is an element of warfare involved in a lot of advocacy. So I often hear people refer to Sun Tzu's Art of War and that sort of thing. But the place where I see that people often lose sight of how that can be helpful information is that the battlefield and the enemies aren't what you think. They're not the legislators for sure. They're not even the people who take a different view on an issue. Usually it's scarce resources is the enemy, and the landscape is everybody trying to get the resources that they need for their particular issue. So going back to that original frame, all of this points to one element being the most useful thing, and that's relationships. And it's not necessarily the relationship of, a legislator that you happen to go to high school with or something like that. It's often a relationship that you establish and build over time as a constituent or as an expert. Can I have the next slide, please? So we're going to talk through a few different examples of this. And we're sort of starting from the low-hanging fruit and moving towards the entrenched warfare. We're going to touch on that a little bit. But the first one is one of my favorite stories from when I was working at the Senate on the Health, Education, Labor, and Pensions Committee. And we were talking with a colleague of mine who worked for a senator from Ohio. And she was telling me about this call that she got. And it was from a doctor in Ohio. I think it was actually a resident who was calling because they had just prescribed their last prescription of buprenorphine. And for those of you who are not in the medical profession, we have a lot of folks from both ed and development and medicine here. Buprenorphine is something that is used to treat opium and opioid addictions. And it is itself habit forming. And so the federal government put a limit on it. At the time, it was 50 prescriptions per doctor. And this particular doctor called the staffer, called their senator in a moment of deep frustration because they had just prescribed their 50th. And then after they ran out of their limit, they had a pregnant mom come in who had an addiction issue with opium or opioids, sorry. And she couldn't prescribe this. And it was exactly indicated for this particular patient. It would have been a significant help to this particular mom. And the doctor sent her away really worried that she was going to relapse and die or relapse and injure the child. And so that particular call from the resident, it was just a moment of a doctor calling that representative. But what it triggered was the Cures Act. So that call led to a series of listening sessions on the opioid epidemic and different things that folks could do with buprenorphine or naloxone and some other things that I'm not in the medical field, so I'm going to mangle if I go too much farther. And it led to legislation that was bipartisan. It had tremendous support. It created a significant amount of investment, and it increased the limit of buprenorphine, the prescriptions that a particular doctor could fill. So going back to that concept of they want to do the right thing and they don't know what that is, and they listen to constituents and experts, that's exactly what happened here. And a tremendous amount of law and policy is made in this kind of fashion. It doesn't necessarily have to make the news, though this eventually did, but it was a quick one because it was a low conflict story. So I want to emphasize that. The next one that I want to discuss is one that's sort of in between, and this is where one of the more difficult elements of advocacy is when folks aren't already attentive to a particular issue, and that's something that we experienced when a coalition tried to engage on the earned income tax credit in South Carolina. So if we can have the next slide, please. So this story starts in 2005, where we had a single representative introduce legislation to expand the earned income tax credit. And I'm going to actually pause. I realize I might not have oriented folks to what the EITC is. The Earned Income Tax Credit is a program that was, I think, initially created under the Reagan administration, and then every president's administration since Reagan has increased it significantly. I'm not sure if the most recent one did, but certainly between Reagan and Obama, every president in between increased the Earned Income Tax Credit. And what it does is it provides, say you make $100 in earned income, you may get $7 for that 100 back if you meet certain criteria, and it's refundable, which means that if you get that $7 even if you didn't pay $7 in on income tax. So usually people who are in this situation have paid in that $7 through FICA or Medicaid tax or that sort of thing. So it was a significant policy win for folks because it lifted a lot of people out of poverty, and it was seen, and it's been the tool that has lifted more children out of poverty than I think any other policy lever. So it was a big issue, and because of all of this, a legislator in South Carolina followed the lead of other states and said, hey, this is such a good idea, we would like to see it here as well. And so she introduced a proposal that would say, okay, if you get $100 in EITC, you're going to get $15 from the state. And that bill was a single author bill, and it kept being reintroduced and nothing happened with it for 10 years. And this is where I want to harken back to the idea that it can be really tricky to make headway on an issue that people don't know very much about. One of the issues with the earned income tax credit is it's income capped, so you don't receive it if you make above a certain income. And as a result, a lot of the members of the legislature didn't have personal experience with this particular tax credit. And so fast forward 10 years, and can we hit next on that one, Lisa? And actually one more time too. We had two different things happening at the same time about 10 years after that first introduction. One is the United Way Worldwide, and as a result, the United Way Association of South Carolina and several United Ways across the state got interested in the EITC and VITA because they were prioritizing financial stability for families. At the same time, our organization, the Institute for Child Success, had published research on child educational achievement that you can tie directly to the earned income tax credit. Now I'm going to take a sidebar here. The EITC is awesome for little kids. So if you are a family with a young child and you get an extra EITC because, say for instance, your state has extra EITC, if you get $1,000 extra, that ties directly to improved kindergarten readiness, 3rd grade and 8th grade reading and math, high school graduation, and college matriculation as your child grows up. So this is if you receive that while your kid is under 5, it has that impact for the entire arc of that K-12 experience. And it's more impactful for boys and boys of color. So it's even more pronounced for those kids. And so it's an incredible policy tool that we can look at. So we published that research at the same time the United Way was engaging, and that led us to, if we can tap that again, Lisa, it led us to include the EITC as a policy proposal from the Early Childhood Common Agenda Coalition. And that group we're going to talk a little bit more about in a bit, but it is a group that represents young children at the State House. And so as a result of that work, we started meeting with legislators. And this is where that expertise and constituency started to really come into play. So we started having sit downs with legislators where we said, we'd like to talk to you about the EITC. And they said, the what? And we had these back and forths where we were explaining what the EITC was, why it benefited kids and why it benefited families. There wasn't a lot of appetite to vote on the particular proposal that was still in play, that was introduced in 2005 and was still there. But people were starting to listen and get interested in what we were talking about. And so if we could tap that another couple of times, Lisa. That was sort of the landscape, speaking to Sun Tzu and what the battlefield is. That was the landscape that we had when we came to another issue, which was the roads crisis in South Carolina. And I know I just started talking about baking a cake and said, by the way, we need to bring in the steak. It's more related than it looks like. And so with the roads crisis coming up, that became a priority for the legislature, that they had to address the roads infrastructure. And in 2017, it came to essentially a compromise that would fund the roads via a gas tax. And by they, I mean the legislature. And at the same time, the governor at the time, actually it's the same governor still, the governor promised to veto any legislation that involved a gas tax. And so this put the legislature and their compromise in something of a bind. And it required bipartisan agreement to make it go forward over the governor's objection. And what happened at that point was one side of the aisle was saying, well, we can't do a gas tax because that's going to disproportionately affect lower income families. And so they were trying to figure out how to overcome that obstacle. And people started saying, well, I've been hearing about this earned income tax credit that specifically helps families who are lower income and who are engaged in the workforce and have young kids. And so the compromise was essentially, they created a pathway where you could get some of your gas tax refunded, but they also created one of the largest non-refundable EITCs in the country. So they enacted, as part of the roads crisis compromise, they enacted 125% match of the federal. Now, when I say non-refundable, that means that you can only get back as much as you have paid in South Carolina income tax. So it doesn't let you, it doesn't account for or replace, say, for instance, sales tax or that sort of thing. So it's different from the federal, but it's still a huge boon to families with young children who are struggling to make ends meet. And that's almost the definition of who receives the federal EITC. And so I wanted to lay this out to show, even for a topic that very few people know about, if you have some organization, you have some coalition, you can put forth that expertise from constituents, and with enough pressure and time and patience, opportunities can present themselves that can make really potent changes for families in the state or in the country, depending on what you're working on. Lisa, can we have the next slide? So that's sort of the mid-range. And then I do want to talk briefly about how this type of dynamic plays out with a big entrenched battle. And you don't get many bigger or more entrenched battles than we saw with tobacco in the United States in the last part of the century and the early part of the century. And one thing that, if you listen to Jamie Moon, our CEO, very often, you'll probably hear him say that in early childhood, we are now where we were with tobacco in the late 70s, early 80s. We get the importance of stopping smoking. We get the dangers that are involved with smoking at the time in the 70s or 80s, but we hadn't gotten to the place where that was really changing our behavior. And sort of similarly in early childhood advocacy, at least, we've now gotten to the point where legislators, governors, their staff, they understand that little brains are growing way faster than you can imagine, and that investments early make a huge difference later. They get that, but behavior change is hard and systems change is hard. And so we haven't quite gotten the momentum that we got with the tobacco movement. But I did just want to touch on how that tobacco movement worked. And we're only going to get into it a little bit, but if you have an opportunity to go read up about the Truth Campaign, their tactics and approach show how you can overcome even very well-funded, entrenched opposition when you're on the right side of the issue. So they were able to, with relatively meager investment in public media campaign, put forth very compelling advertisements, very compelling lobbying strategies. But it was amongst a ton of constituencies, including folks like the American Academy of Pediatrics. Just a huge number of constituencies pushed that forward. And it did allow eventually dramatic changes in law, whereas, if you looked in the 80s, you could not, as a municipality, ban smoking in restaurants. Now it's, when you go into a restaurant, you expect not to be smoking and not to have other people smoking. And a lot of the way they did that, because of the entrenched, well-funded opposition, they really had to go at it from the constituents' perspective. They had to do the public media campaign and get a sea change from people to contact their legislators. So that's sort of the continuum of the level of advocacy. But I did want to start with the buprenorphine story because, if you're not fighting big tobacco, you can have a tremendous positive impact on policy just by calling your legislator and having a conversation about what you're seeing from the field. Can we have the next slide? We're going to get in a minute to how to have those conversations with your legislator or their staff. But first, I want to start on a topic of a lot of folks feel very nervous about advocacy if they work at a nonprofit. So I am an attorney by training, which means I need to state at the outset that I'm not able to give legal advice on this topic, because legal advice is, by its nature, very individualized. So if you have additional questions, please seek an attorney to clarify any legal issues. I'm just providing education about different ways that the law is engaged, but not providing legal advice. And second, this is especially important for day job issues. Be aware of whenever you're thinking about advocacy, especially if you're thinking about it from a personal level rather than an organizational level, be aware of what is, quote, on the reservation or not for your job. Now, even if you want to advocate for something that your employer would not approve of, there are some legal protections for a lot of folks to still engage in that advocacy effort. And specifically, there are some laws protecting political activity. So you can, they can't, most employers cannot fire you, for instance, because of who you voted for. There are some exceptions to that if they apply to you, you probably know. For instance, people who work at a court are very limited in what they can say politically or publicly. So if you're in one of those caveats, you probably, before you got hired, had a conversation with your HR representative. But do be aware that any advocacy that's sort of in the public sphere has an impact on employers, and that can create some dynamics that you want to be at least attentive to. It may not mean that you don't do it, but you want to be thoughtful about it going into it. And then finally, we want to get into, there are certain legal barriers that if you're at a nonprofit, or especially if you're leadership at a nonprofit, or if you're acting on behalf of your agency, you simply cannot do. So that's what we're about to go into. So if you can go to the next slide. All right, so a 501c3 cannot ever promote or oppose a candidate for office. You also, so, if you have a candidate who's just going to be absolutely fantastic for your issues, you really cannot go out and say, please vote for my friend Jim, because that will breach your tax protection status and the IRS will very likely yank it. And then you're no longer a nonprofit organization and you pay taxes and all your donations are taxable as well. Now, as long as you carefully follow that principle, you can, till the cows come home, educate public officials, the members of the public, candidates, and campaigns about the issues that your organization cares about. So for instance, at the Institute for Child Success, we talk to any campaign or candidate or elected official who wants to talk about early childhood issues. We're there, we'll have any kinds of discussions like that they want. And you can also encourage the public to engage in the electoral process. So you can say, for instance, please go vote on November 4, and please pay attention to early childhood issues while you do so. If you get into that, there's some technical legal issues around, say, for instance, if you do that, you have to be really careful about doing it within 30 days before an election. So there are some technical aspects that if you're thinking about getting into this, you want to be attentive to. But if you're noticing, that leaves a huge amount of advocacy that you can do if you can touch base with your officials and ask them or inform them about your issues. You can also, there's a legal definition of lobbying that involves asking a official to take a specific action. So please vote yes on Senate Bill 1, for instance. That is lobbying. Most nonprofits can also engage in some of that. And the technical aspects of that are a little bit beyond this, the scope of this session, but feel free to reach out afterwards and I can point you to some resources if you want to go into that realm. But there's a lot of leeway to do that work and also to do the education work. Can we have the next slide? All right, so as we go through this, please feel free to pop questions in the chat. Normally when I'm doing the session, that would be a place where I would pause and answer some questions as people have them about what they can and can't do in their nonprofit. So if you would like to, please feel free to type that in the chat and I'll be paying attention to that. When you have these conversations with your legislators, there are a few pretty key guidelines that I recommend everyone pay attention to. And the first one is tricky for data geeks. So, I know a lot of us are, and you're my people, and I'm also sorry. But one of the things that data geeks like to do is tell a lot of stats, talk about the magnitude of the problem that we're trying to address as a way to motivate people to pay attention to it. And that's very intuitive to us, and it's also very challenging for lawmakers. Because again, if you go back to, they're hearing that same stuff on 100 different issues, and they simply cannot address all of them. And so one thing that happens is they read those stats, they try and pay attention to them, but if just as a sort of fundamental psychological phenomenon, they fade pretty quickly over time. And so they'll remember, oh, this is important, but it doesn't stick in the same way. But going back to the story about buprenorphine, that story about buprenorphine and the doctor who couldn't prescribe it to the mom who really needed it to survive, that story is the kind of story that then that staffer told the boss, that boss told other members of Congress, that staffer told me, that I'm telling you. That kind of narrative is what humans are sort of built to remember and retell. And so stats and data, it's good to understand your data and understand your stats. But if you can come in with a story preferably about a constituent that official can connect to, you're off to the races. That's going to stick with them for years to come. And even if they can't do what you're asking them to do right that day, it may be that later when there's a roads crisis, it percolates back up in their mind. So always talk to them in a narrative, talk to an elected official in a narrative. And one of the great things about this group is we have lots of stories from our day jobs. The other thing to be attentive to is, we're dealing with this right now on vaccine issues. So if you have seen this, South Carolina several years back used to be the best state in the country with regard to childhood immunizations. And recently we've faded from that spot. We're now back down at the bottom, and we're looking at losing herd immunity to things like the measles. And it's folks at the State House have tried to figure out how to address this. And one of the ways that has come up is to change the religious exemption for vaccinations. So right now, if you would like to not get your kids vaccinated, you fill out a form that says you have a religious exemption, or you have a religious objection to your children being vaccinated, and that's all you have to do. So you fill out the form, you submit it, and your kids can then go to school, even if they're not vaccinated against all the usual stuff. And so policymakers and advocates, like me, looked at that and thought, oh, well, let's just change that exemption. And that immediately created a significant backlash from the religious community that essentially said, you don't want the state involved in this. And it hasn't gone anywhere. And so this is an issue that still hasn't been resolved. We're working with the religious community now to talk about different options and what would work to try and address this. But an important feature of this discussion was when legislators asked about this, a lot of the advocates didn't have a compelling understanding of the other side of the issue that they could articulate in the way that the other side would. And so we're working on that to get to consensus now. But if you can come into a meeting, and I think every legislative meeting I've had, the member or the staff will say, so what's the other person going to tell me about this? Who's disagreeing with you and why? If you can't answer that, it's not that you're dead in the water, but if you can answer it, it puts you in a much stronger position to advance your cause. So take a sympathetic view of the opposition, try and really understand how they would describe their issue, what they've got right, and be able to address that with a number. And sort of related to that, don't be too invested in being right. This work is seldom, I'm sorry, I'm seeing, let me fix something real quick, folks. Here we go. All right. This work is seldom about right and wrong, and it's most often about value trade-offs. So where do we invest next? How do we handle limited investment? Okay. I think we're switching interpreters here, so I'm just making sure. Okay, is that better? And now let me make sure I'm spotlighted. Apologies, folks. Here we go. All right, good. So let me just restate what I just said. It's important to not be too invested in being right or wrong. This work is seldom about being right or wrong, and it's most often about how we handle scarce investments and difficult value trade-offs, like, for instance, public health and religious freedom. I'll also add that it's a series of, as sort of a general principle, expect when you're engaging in this work to have a series of small incremental gains. This is in part just a reality of the work, that when you're trying to do big stuff, It's really hard to do it all at once. It's also a good thing in many cases. You know, there's a lot of feelings around the Affordable Care Act. But one thing that I think folks on both sides of the aisle will agree on is that the magnitude of the change created by the Affordable Care Act made it very difficult to launch it in a smooth fashion. And so if you were watching any of the news stations around 2014 when the exchanges launched, you would have seen a ton of stories about people expecting to be able to get healthcare and then not being able to because the technology just wasn't working. And so one of the benefits of these small gains is that very often they're more effective. You're able to take the time to do it in a more elegant fashion. And again, going back to the EITC as an example, it's much easier to do something like increase the limit on buprenorphine than it is to introduce a brand new idea. And so when you're doing that sort of technical change, you can very often do it sort of under the radar as a technical amendment to some other bill. When you're trying to introduce a whole new tax credit to alleviate poverty, that can take 15, 20 years, depending on the path, or take 5 years of a coordinated coalition, coordinated coalition's work. Can we have the next slide? All right, so the next thing that I would recommend to folks who are considering doing something that's on the harder side, so something like the EITC or where vaccination changes or that sort of thing, is bear in mind a network mindset and common agendas. And this goes right back again to these electeds and policy staffers are in charge of so many things, and they're responsible to so many constituencies that it is very difficult for them to parse out sometimes when folks are disagreeing which one of them's right. So in the Institute's history, when we started approaching the State House about early childhood issues, one of the things we heard was, well, yeah, you're saying that we should do this, but we just heard from another group that was saying we should do something else for early childhood. That was a week after we heard from this other group that was the group working on little kids issues. And you're all saying different stuff. And I don't know how to handle that. And so we got together and we took a playbook from the conservation voters of South Carolina, who formed a coalition as well. And we got together with all of the folks who had been advocating at the State House for early childhood issues. And we pulled together a common set of priorities. Now, this common agenda is not the agenda that any one of our organizations would have picked if it were just us. There's some compromise in terms of what we would want to focus on at any given time. However, all of these things are things that all of the signatories to the common agenda are comfortable with and see as good and good policy initiatives. So that was sort of the balance that we struck on creating this common agenda. And we were able to take that to the State House and say, okay, look, these things are compatible at least. So you're not dealing with multiple organizations who are disagreeing with each other on this common agenda. And on some of these things, we agree that these three things are priorities. And that approach has had a great deal of success. We attribute a lot of the EITC's passage to the common agenda, the advances in early childhood education through preschool, also advanced through the common agenda. And I could go on about that, but suffice it to say, that type of coalition, even when it's small, can be very powerful if you've got consensus among the people who might have approached those legislators in either disagreement or just not singing from the same page. And of course, now we've got 4 leading organizations and 30 signatories. It also, that sort of phenomenon helps give you a great deal of influence, because you're not only coordinating your voice with other advocates who are active, you're giving voice to organizations that wouldn't previously have had the resources to really engage. So now we've got, the United Way of Greenville County hadn't done a lot of state house engagement beforehand. They worked through their membership organization, the United Way Association, but now they've got their signatories on this, or 30 other agencies, that some of which are statewide, some of which are, Darlington County focused. And so you get a lot of you got to get a lot of leverage from that type of activity. Can we have the next slide? All right, so I forgot that. Oh, right, we were going to step into if there were any particular state house topics that folks wanted to discuss. I'm not seeing any that have already been popped into the chat. I'm also not seeing any other questions that have already been popped into the chat. So I'll pause for a minute and let folks who would like to submit any questions that they have. What do you think? Okay, we've got a question here. What do you think about the proposed legislation to require ACEs to be tracked in South Carolina? So depending on and sorry, there's a comment that don't know the bill number. Apologies about that. I have forgotten the bill number as well. This was a proposal that was originally included last session and was reintroduced this session. I think it's representative of an increased attention to ACEs, and that's very helpful. I haven't gotten into the details of the current proposal, so I mentioned that to say a lot of the times the devil's in the details on legislation that does data tracking. It can sound fairly benign, and it often is, and it's often a very good thing. But I'd want to get into the details a little bit, but I think it does reflect positive momentum on the topic of ACEs, and that this is an issue that legislators are starting to pay attention to and starting to try and figure out how to address. It also sort of came up out of a understanding that, let's see, please find the submission. Oh, okay, sorry. I was seeing a question that I thought meant that I wasn't answering the question, but it was talking about CLE credit, or continuing education credit. It came out of a concern that legislators were starting to understand that this was a significant issue for kids, but they didn't have a sense for the magnitude of the issue. They didn't have a sense for instance, is there something about kindergarten that gives us an extra lever that we could address ACEs in kindergarten, because they didn't have a clear landscape of who was experiencing ACEs, when, where. That data is getting a lot more robust, and I have to tip my hat to the Children's Trust on all of their work on ACEs. And more recently, I think we're also starting to see this data that we heard about this morning on positive childhood experiences that can inoculate it. Because I'm a data geek, I have to pause here and say, when you look at the research, there's this tremendous trend towards interventions being more or less effective based on the degree to which they help families create positive, reciprocal, verbal, face-to-face interactions with safe and familiar adults and kids. Which, if you've talked to me more than 5 times, you've heard me rattle that off really fast about positive, reciprocal, verbal, face-to-face interactions with safe and familiar adults. But it's serve and return. That sort of intervention, that sort of interaction really is the core of the brain science that helps little kids develop resiliency. And you see that now in the data on positive childhood experiences. So that's a long way to say, I think that it's a great proposal to be paying attention to from the legislature, and I'm looking forward to how it goes. I just can't speak to the specifics about that particular proposal. Let's see, I'm seeing, okay, I do want to remind you about the continuing education. We've put a link, I think, at the top of the chat. Yes, so that's for early educators, for clinicians who are getting continuing education from the University of South Carolina's medical school. It's USC OMG, I think is the acronym. There will be information about that in the follow-up email to this after this conference concludes in a few minutes. Any other questions folks would like to touch on? Okay. I'm not seeing any. If anybody is in the middle of the typing, feel free to hit return and then continue. But otherwise, it looks like we are at a good point to wrap up and give folks 12 minutes back. Mary, do I pass the mic back to you at this point?
Yes.
Great.
Thanks, Bryan. So we will post the link once more. That was posted 2 times earlier. And thank you for joining our session today. So the link is now in the chat again. If you are claiming the SC Endeavors credit, please make sure that you go on ahead and you complete that Google form. We will be providing a recording of this session as well to all attendees via email and also in the coming days. So of course, thank you to our presenter, Bryan, and to our interpreters as well. You all have done a really great job, and we hope that you all have a great day.
Thanks, everybody. And also thank you to Lee and Terry. Y'all were great all day long.